Namaste everyone, this is Dr. Vanishree for Ayurvani podcast. Here we are today with a special episode with a special guest, Dr. Saritha T, Assistant Professor, Department of Roganidana, STM Ayurveda College, Hospital and Research Center, Udupi. A warm welcome to you, madam, today. Doctor, will you please elaborate on different examination methods that we have in Ayurveda?
The different methods of examination in Ayurveda is based on Roga Pariksha and Rogi Pariksha. Roga Pariksha means it is examination of the Roga. Roga means disease, whereas Rogi Pariksha, it is detailedly examining about the patient. So it comprises of many examination. Acharyas have explained when the patient comes, we need to detail take about the history taking methods. So these history taking methods are well explained in the context of Prashna Pariksha by Acharya Sushruta.
So, what exactly is Prashna Pariksha?
Prashna Pariksha is based on Desha, Kala, Jati, Sadhana, etc. Tenfold examination methods, which comprises of all these history-taking method. With the help of this, we can diagnose a disease or we can know about the disease in proper. We can even prognose the disease and we can even give a treatment modality for this patient. So this helps in mainly for the diagnosis of the Vyadhi or the diseases.
So in Prakshna Pariksha, you told about Desha. So I think Desha is nothing but the habitat or the person where he is living. So how important is Desha in Prashna Pariksha?
Desha not only means it is habitat, it is classified into two. It is Bhumi Desha and Atura Desha. Bhumi Desha, it is habitat of the person, whereas Atura Desha, Atura in the sense it is the body of the person. So in total it is Desha. In a Bhumi Desha, we have classification like Jangala, Sadharana, Anupa, etc. Based on the characteristics of these Desha, we can infer many of the diseases or the dosha prevalence. Based on this dosha prevalence, we can infer the Vyadhi or the diseases.
So you mean to say in Jangala, it is very dry climate or desert kind of climates, as you can see in the desert areas, African continents, etc. And also, Anupadesha is nothing but very humid and wet and humid climates, as you can see in some of the coastal regions. So, how important it is to know that uh, people are belonging to Desha, what kind of diseases they have. How will you assess that in Prashna Pariksha?
So the Desha is Jangala, as you said, madam, it is dry, more of dry. So Vata and Pitta Bhuishta, that is more of Vata disorders or Pitta disorders can be seen in a Jangala Pradesha.
What are the disorders in the sense? Can you just elaborate what kind of disorders are mainly seen in these
For
areas?
example, Pakshagata, Ardita, that is a stroke or facial paralysis or a spondylosis or a osteoarthritis, etc. These kind of disorders are more seen in Jangala Pradesha. Whereas in Anupatesha, it is more of Kaphavata predominant disorders, whereas in Sadharana, it is combination of all Jangal and Sadharana, Jangal and Anupa.
So, how relevant is this Desha in today's world? I mean, how you see Prashna Pariksha in the aspect of Desha?
When a patient comes to you, ma'am, so we have to see from which place he has come or he is belonging to which places. For example, it is South Karnataka, North India, or any other country. So, based on Desha, we can assess some of the disorders. Simple example to give, when there is a water stagnant, we can see more of mosquito-borne disorders. So, more of mosquito-borne disorders, we can see malaria. For example, if a patient comes with a fever, with a history of chills, we can infer the disease malaria based on their habitat. This is a simple example. So the Hiroshima Nagasaki incidents where the radiation exposure was there and still they are suffering with many of the cancerous disorders or miscarriages, stillbirth. This is based on that particular area. Or the incidents of Surat plague incidents, more than 50 deaths. So this is based on Desha. So where they are living and where they are traveling, even the history of travel is very, very important. Many of the disorders like hepatitis, it may spread after the travel. Not only that, if the person from South Karnataka, if they are shifted to Bangalore, we can see the bronchial asthma. If there is a bronchial asthma, exacerbation of bronchial asthma, the condition may aggravate because here it is the hot climate, and in a Bangalore it is a cold climate. So even desha plays a role in a manifestation of the disease and aggravation and relieving factor. Even the food habit of the person will change according to that desha. So we need to consider all these factors before diagnosing a disease, which helps in diagnosis, which helps in knowing the cause of the disease, and even for the prognosis of the disease, which will be very helpful.
So by knowing desha or the habitat, so we come to know that from which region he is coming from, what are the probable disease he might be having, and what are the probabilities of diet he's been following, so that it becomes easy for us to diagnose the disease that he is suffering.
Yes, madam, definitely.
Yes. So after knowing about the desha, let's talk about kala. What exactly is kala? Will you please elaborate on this contest?
Kala is again divided into Nityaga and Avastika Kala. Nityaga is based on Rutu Lakshana. Rutu in the sense it is a season. For example, the Vata Dosha, Grishma Varsha Sharat. Grishma in the sense Vata Dosha, which accumulate Vata in a Grishma Rutu, that is in a summer season. Whereas it aggravates in a Varsha Rutu, that is in a rainy season.
Yes.
So the pain, etc., the disease of Vata that aggravates naturally in those seasons. So what we have to do is we need to pacify this Vata during particular season. So that is based on Rutu Lakshana. And even Atyoga, Yoga, Mityoga of Rutu means excessive rain in rainy season, or no rain in rainy season, or summer in rainy season. All these have the effect on body and even the dosha. So dosha imbalance takes place because of the seasonal impact. So we need to know about these kalas. So that is Nityaga Kala. Whereas Avastika, in the sense it is Swastha and Atura. Swastha in the sense it is a normal person. So in a normal person, in a Balyavastha or in a child, they are more prone for kaphaja disorders like cold, cough, asthma, etc. Whereas in a Madhyama Avastha, that is middle age, the more of pittaja disorders like acne, pimples, etc. And in Vriddhavastha, it is more of Vataja disorders like a pain, back pain, leg pain, or arthritis,
Osteoarthritis, yeah.
just a stroke, etc. So based on the Vaya or based on the Balya, Madhyama, Vriddha age factor also, we can infer there are Kaphaja disorders or Pittaja disorders or Vataja disorders. That is in Swastha. Whereas in Atura, that is, we can know about some of the condition like rheumatoid arthritis, which aggravates in the morning hours.
Okay.
So bronchial asthma, in a night sleeping position, it aggravates. So the Kala has impact on the Vyadhi also, or the disease also. So causative factor of the disease or the aggravation factor of the disease, to know about the dosha imbalance, this Kala plays a major role.
Okay. So kala is nothing but the different types of doshas accumulating, aggravating in the season, in the age, etc.
Yes,
So it's
ma'am.
mainly on the seasons and the age. So
Yes,
when
ma'am.
we consider it that way.
Yes.
Madam, now the third thing is jati. How jati is relevant in our Prashna Pariksha?
Jati means religion. So in a Hindu custom, we had 4 categories: Brahmana, Kshatriya, Vaishya, and Shudra. So these were made based on their occupation. So in this context, or to present era, we can take occupational hazards in the context of jati. For example, brucellosis, silicosis, or more of chemical exposure or radiation exposure leading to cancerous etc. condition, or dust or cold weather. So etc. We can infer some of the disorders like bronchial asthma. If the person is continuously exposing to AC, the bronchial asthma increases. Or if a person continuously exposing to dust, any skin lesions may happen, or unhygienic condition, etc. Or the person belonging to like a night shift, more of vata vriddhi. It is a ratri jagarana causing vata vriddhi. We can infer many of the vataja disorders. Or if they are continuously working, it is a stress environment, more of mental disorders. So based on their occupation, we can infer many of the disorders. It may be a precipitating factor, or it may be acting as a causative factor. So jati, in this context, we can take a occupational hazardous, ma'am.
So mainly you mean to say jati is nothing but which occupation he is into. So we
Yeah.
can interfere or infer about what is he doing, what is his occupation, and that might be the major cause for his disease.
Yes, ma'am.
That is what we have to consider in Jati
Yeah,
Pariksha.
it may be or it may not be, but we
It is
need to
one of the
consider.
factor.
Yes.
Yes,
So the labor workers continuously they'll be working for 8 or 10 hours. So some of the Vata Vyadhi, as it is Ati Vyayam or excessive exercise, it is a causative factor of Vata Vyadhi.
correct.
So any of the Vata Vyadhi like backache, neck pain, radiating type of pain, or osteoarthritis, these are all common in those they work for longer hours. So all this comes under the context of Jati.
So today we came to know about what is Desha, what is Kala, what is Jati, the habitat of a person, where he belongs to, what is his diet habits, and which occupation he is into, which helps us in understanding the diagnostic factor, the diagnosis of the disease, and also prognosis, how big is the disease, whether it is acute or chronic, and also it will help us in uh, setting up a treatment modality. Now we know about the three main factors. Let's learn more about other factors, madam. Will you please elaborate on what are the other factors?
Other factors are like Satmya, Atanka Samutpatti, Vedana Samuchraya, Bala, etc. Madam.
So let's do all these factors in detail in the coming episode. Thank you, madam.
Thank you.